How's it going, guys? Past level question, Pharm Step 1, Internal Medicine 2CK, 34-year-old male evaluated by a physician. He's in a methadone program. Opioid receptor agonist used to curb cravings in those with opioid/heroin use. The implication being he's an IV drug user. Which the following most appropriate next best step in pharmacologic therapy? We have this smear here, which I'll talk about as we move through. Choice A, benznidazole, wrong fucking answer. Non-existent drug on NBME, USMLE. Shows up in Qbank. Qbank is not the same as USMLE, okay? In theory, it can be used to treat Chagas disease, American trypanosomiasis. Chagas disease does show up on USMLE, albeit lower yield. USMLE wants you to know what it looks like on a blood smear. So you can open a separate tab, type in Chagas blood smear, okay? And it's spread by radiovid bug, aka kissing bug, because it is a painless bite and causes dilated cardiomyopathy, megaureter, megaesophagus, so secondary achalasia, and toxic megacolon. Wrong fucking answer. Choice B, mebendazole, wrong fucking answer. So this is a microtubule inhibitor used to treat primarily roundworms, nematodes. So mebendazole, griseofulvin, colchicine, vincristine, vinblastine, these drugs all inhibit microtubule assembly. The taxanes, so docetaxel, paclitaxel, prevent microtubule disassembly / they cause microtubule hyperstabilization. Wrong fucking answer. Choice C, TMPSMX, correct answer. Diagnosis is pneumocystis jirovecii pneumonia. We're looking at a bronchoalveolar lavage of the silver stain with the yeast. I jacked this image off of Wikipedia. Extremely buzzy image, okay? So it's not hard. So this is what's going to go down. You see this question and you say, Mike, really? We're supposed to know this image? Well, I said it's a buzzy image. Okay, it is past level, but let's say you didn't know the image. Okay, let's give you the benefit of the doubt here. We said methadone program, so you say, well, that means IV drug user. IV drug use means HIV. And you say, well, what do patients with HIV classically get that's absurdly high yield for USMLE? Well, pneumocystis jirovecii pneumonia. So you look at this image, you say, oh, you know what? Maybe I have seen this before, the silver stain with the yeast. Well, let's say even still you didn't know this image. Pneumocystis jirovecii, we treat with TMPSMX. It's what we do. I've said in my prior clips, I've said, when you don't know an answer, don't choose weird sounding shit. Benznidazole, instantaneously wrong fucking answer for that reason. Now, you may have been tripped up and said, well, maybe this could be worm related. Maybe we're looking at ova. It's not, okay? It's TMPSMX, the silver stain, the cyst, it's fungal. And then let's look at the other answers here. So Vanc plus ceftriaxone, wrong fucking answer. This is used for community-acquired sepsis for many things, okay? So patient comes in a hospital and has sepsis / septic shock. It could be pneumonia. It could be spontaneous bacterial peritonitis, pyelonephritis. So many infections. We like to give ceftriaxone if they ask you one drug, and sometimes they throw Vanc on top of it. It's not that we're worried about MRSA from the community. It's just occasionally community organisms can have resistance to ceftriaxone, so sometimes they throw Vanc on it. I've seen 2CK questions do that, okay? So when you see the combo of Vanc plus ceftriaxone, that's just community-acquired sepsis. It also happens to be the community or the empiric therapy for meningitis. Wrong fucking answer. Choice C, Vanc plus cefepime, wrong fucking answer. This is one of the regimens that's used for hospital / ventilator acquired infections, broad spectrum covered. So Vanc for MRSA plus cefepime, a 4th generation cephalosporin, or ceftazidime, a 3rd generation cephalosporin. Those two cover Pseudomonas. Okay, so you ask students about hospital acquired infections, what's broad spectrum? Get pip-taz a lot, piperacillin and tazobactam. I've seen that asked once on an NBME exam. It's not the highest yield regimen, okay? It's going to be Vanc plus cefepime or Vanc plus ceftazidime, and they'll do that. They'll give you a big 15-line paragraph. They'll say patient has been in hospital for a few weeks, has an infection with sepsis. They'll say vancomycin is commenced. Which of the following agents should be added to the pharmacologic regimen? And the answer is cefepime, okay, or ceftazidime. In this case, wrong fucking answer. You know the deal. I'm going to make more content. If you like my stuff, subscribe to my channel. I appreciate your time. That's it.